program manager for the 912 pharmacy.
Okay, so we got the 912 farm truck at the Memorial University Medical Center. What's this program? Kind of elaborate on who it's geared towards.
Yeah, so this program is part of a produce prescription grant from the USDA. So it's a 3-year grant that is a partnership between the Forsyth Farmers Market and 4 community clinics. So Memorial Children's is one of those clinics, as well as J.C. Lewis Primary Care, the Chatham County Health Department, and you can edit this one.
Yeah, this information.
St. Mary's?
St. Mary's, yes, thank you. St. Mary's, St. Joseph's Community Center on 36. So those 4 clinics are all our clinical partners. And the program is that they have participants that are low income, low insurance folks that are on SNAP or maybe Medicaid, or their children are on CHIP, and they have or are at risk for a chronic diet-related disease, something like diabetes or high blood pressure. So the produce prescription aspect is that their nurse practitioner, their physician, their healthcare provider prescribes them the 912 food pharmacy program. So they come out once a month to receive some nutrition education, learn a little bit about local produce, something that's in season. Today we have blueberries. Blueberry season just started in Georgia. They'll come out, we'll talk, we'll get to know them a little bit, and then they get an incentive based on their household size, so they can purchase fruits and vegetables to feed their family for the month. And then once a month they come back, you learn about some other sort of fruits and vegetables, same deal, and this program will go for 6 months. So we're hoping between now and October, we get to know some folks, help them really make some differences in their diet.
Where does this produce come from?
Produce all comes from within 200 miles of Savannah. So we are partnered with almost all the vendors that you would see at the farmers market on Saturday provide the produce that goes on the truck. So a lot of this either comes from just across the border in South Carolina or out in Effingham County. It depends on exactly what you're getting, but it's all fresh local stuff to the Low Country and Coastal Empire.
So knowing that you're involved with this bridging the gap between farmers and the children and the families that need this, how does that impact you?
Yeah, so a lot of people don't realize that the Forsyth Farmers Market is actually a nonprofit. It's not just the farmers market. So we're a nonprofit with the mission of food access for all. So getting people who grow the food in touch with people who need the food and kind of supplying a platform so that those 2 people can find each other. So for us, it's a really big deal to just be able to share the wealth that is the agriculture community in this area. We have a very rare ability to have a year-round growing season. And so that means that anybody in Savannah, anybody in Charleston, anybody in Hilton Head could eat local fresh produce all year round, which is just incredible. And it's actually very, very affordable. A lot of people think of organic produce as kind of a luxury item. It's actually one of the cheapest things you can find. A lot of people don't necessarily know what to do with it, how to prepare it, how it can be a part of their diet. So our goal is to kind of bring those 2 groups of people together, help them figure it out together, and then hopefully have a positive impact on the business for local agriculture, as well as the health of the people in our community.
And how do you feel about bringing something like this to this community?
I think it's great. We've always done SNAP enrollments since we became a nonprofit. We've tried really hard to partner with communities that have typically been overlooked and underserved. But this is a really direct, specific program where we're partnering with the physicians and the healthcare providers that know their clients and know what their need. And so we're able to directly say to a person like, hi, it's nice to meet you, here's what your problem is, and then let us help you try to figure that out together as a team. So it's a really nice way to be very embedded in the community.
How big is the grant and how many people can it serve?
So the grant is for $455,000 and it is spread over 3 years. This is the first year. There's no cap on the number of people that can participate. There's a cap on the amount of incentives we can distribute every year, but that cap is $90,000. So it's a large sum of money. And if we don't use it all, we have to give it back to the USDA. So we want to recruit as many people as we can to make sure that those incentives get distributed, especially now when we know food access is an issue with kids being home during the day, not being able to get lunch at school. Families may be suffering with layoffs and may need extra help getting food on their tables, and so we think it's extra important to get these incentives distributed right now.
What have you seen during these last 8 weeks with the use of the farm truck in general?
The farm truck has exploded in the last few weeks. I think we've done like over 50%, doubled like up to 50. What's the terminology we use?
About 300%.
We've done 300% of our normal sales over the last month or so. on the farm truck alone. I mean, the farmers market itself is doing really well also, but the farm truck, because it's out and about throughout the week, is able to hit a lot of different audiences that typically wouldn't have been able to access it. So we're actually kind of having trouble keeping up with demand, which is a good problem to have, and we're happy to support our farmers as much as we can. And you know, it's been a really interesting process for us during this time.
Great.
Oh, and do you know how people can register for the program?